Morning everyone. In a moment Dr Veach will provide his update. We'll be joined also by Catherine Morgan-Wicks, who will provide an update on vaccinations, and Donna Adams, who can provide an update on policing matters as well. Look, first and foremost, I want to thank all Tasmanians in the south for the way that they have engaged and worked with us over the past few days. I know it's been very difficult minimising movement, but importantly people have done it, and what I'm very pleased to say is that we're on top of this, and as of tonight at 6 p.m, as per the plan, the lockdown will be lifted. Importantly, the testing numbers continue to be high, and there were more than 1,463 tests yesterday, so thank you to everybody that took part in that. Look, there will be, however, some additional restrictions. Importantly, I do want to explain it this way, that we are effectively snapping back, apart from there will be a need to wear masks until 6 p.m. on Friday. It will be reviewed on Friday morning, and we'll provide further update then. But I think, and importantly, public health are of the view that we need to take that extra precaution for the next period throughout the course of this week, and also the restrictions that currently apply for aged care and our hospitals will remain in place as well through the course of this week until 6 p.m. on Friday night again, but obviously being reviewed during the week. So in effect, we are snapping back to where we were, apart from those restrictions. And I do want to spend just a little bit of time on the mask wearing, so that people are very clear about how that's going to apply both in the community but also in our schools as we move forward. So masks will apply indoors and outdoors for anyone 12 years and over, unless in your own home or in your own vehicle driving either by yourself or with your immediate family. Importantly, if you visit someone else's home, you must wear a mask. Importantly, if you leave the 12 LGAs, the region that was locked down, and travel south out of, or travel north out of that area, you must continue to wear your mask whilst you're in another part of the state. And likewise, if you're somebody travelling into the 12 LGAs from another part of the state, you will need to wear a mask as well. Now, just to clarify some matters in terms of this, in terms of the questions that we received over the weekend, bearing in mind that we have had such a fantastic run in terms of not having to go into lockdown, and obviously mask wearing is something across our community that we have not been used to, but in the main most people did the right thing. But first and foremost, if you're undertaking intense exercise, you do not need to wear a mask, for example running or cycling. I know that a number of cyclists have had it explained to them quite clearly by passing motorists that they should be wearing a mask. If you're cycling and that meets the test of intense exercise, you don't need to wear a mask. Wear a mask in the office, but if you're alone in an office or a workspace by yourself, then you don't need to wear the mask unless someone enters the room, and obviously that person should be wearing a mask. If you're working by yourself in an outdoor space with nobody else around you, then you don't need to wear a mask. You need to wear a mask to a restaurant or to a hotel, but to eat and drink, you can remove the mask. I think we've all had some experience at that over the last period. In regards to masks at school, masks are required for all students except those aged under 12 years or students at a primary school. But importantly, for those 12-year-olds that might be still attending primary school, there's no need to wear a mask at school, but you need to wear your mask attending school, heading to school and leaving school. Importantly, we'd hope that children could bring their own masks. However, if your child attends a government school and doesn't have one, the school will supply one from its own stock. All teachers and school staff in any schools are required to wear masks, subject to the same exemptions as others. For teachers, there are two matters that are particularly relevant. Obviously, where clear enunciation or visibility of the mouth is essential, you can take your mask off. Communicating with a person who is deaf or has impaired hearing and visibility of the mouth is essential for communication. Again, your mask can come off. Like any other workers, exemptions will be provided for those with a physical or mental illness, condition or disability that makes the wearing of a mask unsuitable, subject to suitable documentation. Importantly, anyone with concerns should speak with their school. For school and organised sport, there is not an expectation that masks are worn. However, masks should be worn to and from the venue and when not actively participating. So if your child is having a game of soccer, they don't need to wear that it's through their organised sport, or a game of basketball, but they should wear their mask to and from the venue. For a full list of mask requirements, please visit coronavirus.tas.gov.au. And again, whilst this is going to be an inconvenience, there are others that have been wearing masks now in this country for the better part of 12 months. I'm sure that in the same way that we have stood up and dealt with the virus over the past 20 months, we can deal with this as well. Importantly, regarding business support and those that have been affected, for any Tasmanian who is required to undertake 14 days of quarantine and who can't earn an income because they have been asked to self-isolate, quarantine, or they're caring for someone who has COVID-19 and quarantining, there is support available through the Australian Government's $1,500 pandemic leave disaster payment. Further, there are the pandemic isolation assistance grants at a state level for those who are directed to have a test or are placed into 14 days quarantine, with financial assistance of $250 per adult and $125 per child, capped at $1,000 per household. In addition, as I announced on Saturday, the government will extend access to people who've lost income over the weekend to the Pandemic Isolation Assistance Scheme, to include people who were impacted by the stay-at-home order but not necessarily placed into quarantine for 14 days and have lost income and meet the criteria. We've also been working very closely with the Australian Government, who have a COVID disaster payment. It was agreed at National Cabinet that in terms of that would come into effect when an area is designated as a hotspot, which we have been, but there is a time period of 7 days. Working with the Commonwealth, I'm very pleased to announce that will be available on a pro rata basis for Tasmanians in terms of the short lockdown, and people can log on from this coming Friday onto MyGov, and the pandemic disaster payment on a pro rata basis will be made available for them. In terms of broader business support, obviously we've been engaged with the business sector over the weekend. Business Tasmania are in the process of developing a broader package. Obviously there have been some businesses, especially in terms of spoilage, where they've had significant stock on hand, expecting to have either a function or a large weekend of trading, and spoilage has occurred. Business Tasmania are currently working through the final details of this package. It will be one-off. We'll wait for further feedback over the course of today, but I expect that we'll be announcing more on this in coming days, and this will be a one-off targeted package. I do remind businesses seeking information on the grants to please call the Public Health Hotline on 1800 671 738, and Business Tasmania can be reached on 1800 440 026. Later this week, we expect to still be able to communicate Tasmania's roadmap in respect of the reopening of our borders, especially to those states of Victoria and New South Wales, and also the ACT. I would encourage Tasmanians to continue their efforts in terms of vaccination, and also importantly in terms of testing. One of the concerns that we had on Friday was that the information that had been provided wasn't fulsome, that we didn't have a good understanding of where this virus might be in our community, and the testing that's occurred over the last 3 days has been very informative to public health to ensure that they have been able to form a view as to the level of risk in our community. And importantly, as I've said, we're in a position where we will be able to snap back out of this tonight at 6 p.m. with some minor restrictions still in place. In terms of vaccination, we're currently just under 89% of Tasmanians over 16 having had one dose, and 68.5% are now fully vaccinated, and Catherine Morgan-Wicks will provide more detail in terms of that. In respect of our plan, I expect that we will achieve 70% fully vaccinated by Wednesday this week, which is very positive, and we remain on track to achieve 80% fully vaxxed by Melbourne Cup week in line with our plan. Now, that puts us in a great position to reach our 90% target by the 1st of December, and importantly, the efforts that we're seeing right around the state now with the mobile buses, the walk-in clinics. I'm increasingly becoming much more confident that all Tasmanians are having the opportunity to be vaccinated. Once again, I want to thank Tasmanians for their efforts over the past few days. I want to also acknowledge those working in our hotel quarantine system, and again, to make the point, to be clear, these are hotels. They are not correctional facilities, they are not prisons, and they rely on those in them to do the right thing. We've already moved to provide additional security personnel at our domestic quarantine hotels, with Tasmania Police now also stationed at the hotel that is quarantining the close contacts of the case. Additional CCTV has also been installed as a result of a review, and I'll have more to say later this week in terms of the broader review that has occurred in terms of quarantine. I do want to once again just acknowledge all of the government staff for their efforts over the weekend. Thank them for assisting Tasmanians when they needed assistance. Importantly, thank them for being prepared to work longer hours in terms of vaccination and testing. And once again, say to Tasmanians, thank you. This has been a difficult and challenging period, and something that we have not had to experience for the better part of this pandemic, unlike other jurisdictions. But Southern Tasmanians put their shoulder to the wheel. They did what was asked, and we are now in a good place. And as I've said, the lockdown will end at 6 p.m. tonight, as we had previously planned for. I'll now hand over to Dr. Veitch and then take questions at the end.
Thank you, Premier, and good morning. I'm glad to be able to be here today and to follow the Premier's message that we're able to relax the lockdown measures at 6 o'clock tonight, and to thank Tasmanians, as he's done, for their understanding and their cooperation with the measures that we required of them. As the Premier said, that from midnight tonight, the measures that we put in place on Friday will be substantially dropped, and that will mean that the principal requirement we'll have of people in southern Tasmania will be wearing masks when they're outside their home, and the Premier mentioned the various exceptions for that, and I encourage people who need clarification on the requirements for mask wearing to look at the coronavirus website, because we know that Tasmanians aren't as familiar with mask wearing as people in most of the mainland states. It will be permissible for people to move between the southern region and the northern region, but people moving from south to north will bring with them the requirement to wear a mask when they're out of homes, and people travelling from the north to the south will be required to wear masks when out of their residences here. The other measures that we will retain in place until Friday at 1800 are the limits to visitors to hospitals and aged care, but they will be reviewed along with the mask wearing requirement during this week, in the hope that they too can be relaxed on Friday evening. We're able to do this because of the fact that we had no cases identified amongst our contacts, and because we had no further information to suggest that there are any unmanaged exposure sites. We're also heartened by the amount of testing that was occurring, but I do need to remind Tasmanians that you really need to get out and get tested if you've got any symptoms in the next week or two. We will still have people required to quarantine because of their exposure at various sites early last week for 14 days. So that quarantine period for all of those people won't end until Tuesday the 26th, and they'll be having some more tests in the course of their quarantine. But across Tasmania in both the south and the north, please go and get tested if you have any symptoms in the coming week or so.
What about density limits? Will there be any density limits that apply to certain places?
The density limits will return to the 1 per 2 square metres that we've had before this.
Are you surprised that no tests have come back positive as a result of this latest case?
The situation with people who are infected with COVID is that many people actually don't spread disease to anyone, including their close contacts. But many also do spread disease, and you can't tell at the outset who's going to be a spreader or a super spreader or not. And as of Thursday night, when we got information about the new exposure site, before that we felt that there were relatively few people at risk. But after we learnt of the Woolworths exposure site during Thursday, and we verified that during the day and clarified the times when there was risk, we had entered, I think, ultimately 120 odd additional people, and all of those people had been in the community for several days when they too could have been theoretically infectious. So there was a lot of unmanaged risk that we needed to address, and that was the principal reason why I recommended the lockdown. In the end, I'm happier to be here and saying that there have been no cases over the weekend than to be telling you there are multiple cases that we then need to deal with.
Is there any outstanding tests? Does that mean all the close contacts have been tested and had their results back?
We've got 6 people who we're still ensuring have got their test results. The test results, there's about 170 or so, I think, close contacts listed now. And there's a handful of people whose test results we're chasing. Some people actually get tested in the private system and we have to chase those tests down, or there's been a delay in actually getting a test conducted. But I'm happy with the vast majority, or almost all of those people, having a negative test back in the right kind of time frame. Gives me confidence that we can take the measures we're taking at 6 o'clock tonight.
These people, are they of primary close contacts? Or?
They're not household-like contacts. They're not the highest risk contacts. There are 15 people that we identified who had really prolonged and very close contact with the case, and none of those people have tested positive. They're by far the most likely group to test positive. The circle of people beyond then who had more fleeting contact are much less likely to become positive. But we'll be tracking down the last handful of those people today to try and get those test results through, so we've got a full, so we've done them all.
There are going to be people who say, oh look, there's been no cases, therefore the lockdown was unnecessary. What do you say to people who raise that argument?
Look, I understand that people can ask that question, David. It's a reasonable question. It's one of the paradoxes actually of preventive measures generally. Not everybody who has high blood pressure will have a heart attack or a stroke, but we put measures in place. Even, I hesitate to say it, not everybody who smokes will get lung cancer, but we don't recommend that people go out and smoke. So we sometimes take measures to prevent adverse outcomes at a population level. And in this instance, there was substantial risk out there. We knew that this person who was in the infectious phase of his illness was out in the community for 18 hours, had been to places that we're only just identifying, and could plausibly, even now, have been somewhere that we haven't identified. That's a high-risk situation for Tasmania, and we were moving and mixing like it's 1999, really, and we had to put measures in place that prevented the risk of transmission beyond the people who had been in contact with the case. And this is a strategy that many jurisdictions around Australia have done. I think Tasmania was the last jurisdiction to experience lockdown of their capital city, and most of the other capital cities around Australia have had lockdowns. They've put them in place for short periods, and they've got out of them fairly soon without cases occurring. So my advice was based on risk and a cautious approach.
Are we to take from today's announcement that that risk, or the worst of that risk, has now passed, and that we're not likely to go back into another lockdown?
I think I will say I think it's likely that the worst of the risk is past. The evidence that we have so far is that we've not identified any cases either from the closest contacts, the slightly wider circles of contacts, or from the community, and that's good news. But as I said, we've still got people in quarantine for another week and a bit who could go positive. And obviously if they're in quarantine and not mixing with other people, then that doesn't pose a risk. But there remains a small risk that we haven't actually got absolutely everybody identified who had some kind of contact with this case. So I think we have to be very vigilant for the next week, and that's why we've recommended that we continue some measures such as mask wearing, at least for the short term.
Some talk around making this a week-long lockdown rather than 3 days, and that some people within public health may have recommended that. What's your opinion on that?
That's not true.
Good morning, everyone. Yesterday was another good day of testing with 1,463 tests conducted, including 275 at Gagebrook, 458 at Mac Point and 320 at the Deck. Over the last 3 days, close to 5,000 COVID-19 tests have been conducted, which is a fantastic effort, and thank you to everyone coming out and getting a test. As we ease out of lockdown today, it is critical that our testing rates remain strong across southern Tasmania. We do not want a case of COVID-19 to go undetected in the community, so please come forward and get tested if you have any symptoms or concerns about being at or near an exposure site. Please then isolate until you receive a negative test result. Importantly, even if you are vaccinated, you need to get tested if you have symptoms. If you need to be tested in the south today, please visit My State Bank Arena, formerly the Derwent Entertainment Centre car park. This will be open until 6 p.m. today. With no booking required, just turn up and get tested. Chris Fitzpatrick Memorial Park at Gagebrook, with testing available until 9 p.m. this evening. No bookings required, just turn up and get tested. Macquarie Point in Hobart is open until 9 p.m. this evening. To make a booking for this clinic, call the Public Health Hotline on 1800 671 738 or visit coronavirus.tas.gov.au to book a test online. If I can talk a little bit about wastewater testing. Tasmanian's wastewater testing program continues as part of surveillance for COVID-19, and we have ramped up our wastewater testing across southern Tasmania. The following Hobart sites are sampled weekly as part of our routine wastewater testing program: Rosny, Macquarie Point, Prince of Wales Bay, Sells Point, Blackmans Bay and Cameron Bay. The following sites are normally sampled monthly but will be tested over the next few weeks: Green Point, Rokeby and Cambridge. And we will also add the following additional wastewater sites in response to the positive case: East Risdon, Richmond, Midway Point, Sorrel, Turriff Lodge, which services New Norfolk, and Ranelagh. In particular, the Green Point site, which services the outer northern suburbs, is being resampled today, with test results in coming days, and we will retest regularly these critical sites over the next 2 weeks. On to vaccination. The highly successful Bridgewater Vaccination Clinic will again be open extended hours from 9 a.m. to 9 p.m. today, and will be accepting walk-ins and booked appointments. This clinic opened last Thursday and has delivered first dose vaccination to over 1,350 people over the last 4 days, and it will also now be open tomorrow on Tuesday the 19th. The Bridgewater Clinic has been a powerhouse and has helped to lift vaccination rates in that area by over 7%. And for the Brighton LGA, our 12 to 15s have also increased by 23%. Now, last Sunday we were at 10% for our 12 to 15s in the Brighton LGA, and we are now at 33%. And this is really enormous in such a short period of time. My thanks go to everyone in that community that made the decision to walk in and get vaccinated. Our vaccination sites open in southern Tasmania today are Brighton Civic Centre, 9 a.m. to 9 p.m, Princess Wharf number 1, 9 a.m. to 5 p.m, Blunston Arena, 9 a.m. to 5 p.m, Mona 9am to 5pm, Your Church Moona 9am to 5pm, Ooze Community Centre this morning 9am to 12pm, and Hamilton Hall from 1pm to 4:30pm. A clinic will be held at the New Norfolk District Hospital tomorrow, Tuesday the 19th and Wednesday the 20th from 9am to 5pm. We are now over 68.8% fully vaccinated and 83.8% with a single dose. And pleasingly, these numbers continue to lift across the Brighton and Southern Midlands LGAs, and there are clinics in the Central Highlands and Derwent Valley this week. Over the weekend, we also passed the milestone of more than 300,000 Tasmanians being fully vaccinated. Currently, the number stands at 304,076, and the weekend also included more than 2,000 of our 12 to 15s getting vaccinated. Yesterday, though, we still saw around 4% of our bookings not show up for their appointment. Please, if you have a booking, please turn up. Vaccination is our best protection against COVID. For the North and North West, there are state clinics open at South Launceston Door of Hope, Devonport Surf Lifesaving Club and Burnie Arts Centre today. The Tasmanian Government RFDS buses join the rollout from today visiting St Leonard's, which has a population of over 2,000 people. So please, if you live out that way, look out for the very white RFDS bus and jump on board for your jab. One of the buses will be in Westbury again, with a population of just over 2,000 people tomorrow. So I look forward to seeing those regional areas really support their communities by lifting their vaccination rates. So can I end by echoing the Premier and thanking all of our really hardworking health and emergency teams who have worked tirelessly over the last weekend to help protect the Tasmanian community.
On that RFDS bus, would it likely do a second trip around the state for those people who miss out the first time around or can't make it?
So our RFDS and Tasmanian Government bus will be doing both Dose 1 and Dose 2 tours around the state, and we will pick up extra Dose 1s on that second trip around as well.
Given masks stay mandatory, why are we going to still restrict visitors to hospitals and aged care facilities?
So our hospital and aged care facilities house our most vulnerable cohort and population in Tasmania. So whilst we ease out of the restrictions from this snap lockdown, the masks have been recommended by Public Health, and that continuation of visitor and mask restrictions in our aged care and hospitals to protect our most vulnerable.
A huge increase in the north in terms of vaccination rates. Have we seen that elsewhere in the state as well? Has it given an overall lift?
So we have been running our youth clinics across the north and northwest as well. So we expect those 12 to 15s and our 16 to 18s to continue to rise in the north and northwest. But I really do call upon our north and northwest communities. You can see exactly what has happened in southern Tasmania over the last few days to really make sure that they are getting in and vaccinating if they are unvaccinated.
And how has the lockdown over the weekend impacted operations at the hospital, if at all?
So we've actually had a quieter weekend in our hospital environments and ambulance environments over the weekend. However, particularly for ambulance this morning, it's already jumped by some 30% in terms of impact on operations. So it's pretty much returning to a normal effort, and our hospitals remained, ready and waiting over the weekend to serve as needed.
Questions for Donna Adams?
Good morning, everyone. How are we going? It's pleasing to see the continued level of compliance by Tasmanians who are subject to the lockdown restrictions. And there have been some really nice examples of police interacting well with members of the community. Out in Bridgewater, we had a group of young people in a park and police providing those young people with a mask so that they could comply with the requirements in terms of mask wearing. From 9 a.m. yesterday till 9 a.m. today, police have checked just under 500 vehicles at the checkpoints that we have on the boundaries to the 12 local government areas that are subject to the restrictions. We only turned around 37 vehicles, directing those drivers back to their primary residence, and that's a significant reduction and really does demonstrate that Tasmanians want to comply with the lockdown requirements. In terms of infringements, we've issued 13 infringements which were cautions, and we've issued 3 fines. They were for a combination of failing to wear masks or where people didn't have a permitted reason to leave their residence. From a policing perspective, we've used statewide resources over the last 3 days to ensure that the lockdown requirements have been maintained and complied with by the Tasmanian community, and we're certainly keen to see the restrictions lift this evening, and we think that the Tasmanians have their actions have contributed to public health's decision to allow the restrictions to be removed.
Has this level of compliance been much greater than what police were expecting? Has it been a good surprise?
I think we've been pleasantly surprised. I mean, we've always taken the approach that we wanted to work with the community and educate people where we could, and we'll continue to do that with the mask wearing requirements that'll continue for the rest of the week. And I think that the community have engaged really well with the advice that police have provided.
The Premier obviously wants you to come down quite hard on anyone that does breach requirements. How much of what he wants you to do you listen to, or are you quite autonomous in your decision making?
Tasmania Police is very autonomous in our decision making, and in fact every police officer has a level of discretion on their own to exercise when they're dealing with individuals.
So the Premier deciding to come down hard on somebody that doesn't particularly sway your position?
Tasmania Police has a level of independence in terms of its investigations and how it looks at compliance, and we make those decisions based on our own assessment.
So over the course of this week until Friday night, what will police be doing just to, I suppose, keep in place that level of compliance with the mask mandate?
Well, the first thing we'll do is obviously, we'll ensure that we're demonstrating and leading by example in terms of the mask wearing. We will continue to educate members of the community, and we ask members of the community to comply with the mask requirements. They're an important step down from the lockdown, so we would ask that compliance to continue.
If somebody doesn't have a home and is living on the streets, where can they go to get a mask?
We're happy if anyone hasn't got a mask. If we have an interaction with a homeless person, we're certainly happy to provide a homeless person with a mask.
And given the suddenness and the complexity of the rules that were introduced on the community on Friday, how pleased are you overall that the amount of compliance seems to be fairly high?
I think that comes down to the planning. There's been some really strong planning in terms of the lockdown, and I think the Premier has been quite open in sharing the lockdown plans some weeks ago so that communities and businesses had some understanding of what lockdown requirements might look like. I think that's definitely helped in terms of people understanding what might be required in terms of this 3-day lockdown.
And does increased monitoring of compliance of mask wearing mean that police can't put as much resources into their normal day-to-day activities?
Police prioritise the resourcing and their focus based on risk. At the moment, the highest risk to the southern part of the community is to ensure that this lockdown was enforced, and we just use our resources based on a risk assessment.
Question to the Premier.
Same question I asked Dr. Veach. Some people are going to say that we've had no further cases. Are you satisfied that this lockdown was necessary and the right thing to do?
Look, experience in other jurisdictions has indicated that with Delta, you can never be too early, you can only be too late. And so in terms of the risk that was identified by Dr. Veach in Public Health on Thursday night and then obviously discussed over the course of the early part of Friday, I'm very comfortable with the steps that we've taken.
Is the plan still to have this 31-year-old man transported back to New South Wales at the end of his quarantine, and how would that impact any police investigation that needs to get underway?
Well, look, that's obviously a matter for police. They'll work through those matters.
And the show coming up, Premier, are we confident that can go ahead with masks?
Well, the show would have been having masks wearing because it's an event of more than 1,000 people, and so yes, there's no impediment at all, I would see, to the show going ahead at this stage.
And that's fine with the 5,000 people. You're comfortable with having crowds gathering there?
Look, that's a very large site, and again, I think in terms of mask compliance, and whilst there've been the odd infringement that Donna has mentioned, yesterday I did take it upon myself to do my 2 hours worth of exercise and walked around the city, and I was very pleased with the level of mask wearing that people were undertaking. It was really pleasing to see.
What about with the WBBL games? Will there be crowds able to return this week?
Well, with the snapback, obviously we would revert to the original COVID safety plan that was in place for BBL, for WBBL.
Yep, so from tomorrow then?
Well, from 6 p.m. tonight, obviously we snap out of this.
In terms of people travelling for the long weekend, I imagine there's going to be quite a spreading out of people from the southern region. Is there any advice around that? Should people reconsider their need to travel?
Well, again, importantly, wear a mask if you leave before Friday at 6 p.m. Now, in terms of mask wearing over the weekend, obviously we will review that on Friday and we'll provide another update at 11 o'clock on Friday morning. I would hope that Public Health are confident that the risk has continued to decrease, that we haven't seen anything else materialise, and therefore I'd hope that mask wearing over the weekend for the long weekend wouldn't be required. But again, at this stage that mask wearing is in place until Friday night at 6 p.m.
As vaccination rates rise, do these sorts of snap lockdowns become less and less likely, and by December, if we hit 90%, is the risk of that pretty much non-existent?
Well, look, as you'd all be aware, under the national plan at 70%, which we will hit fully vaxxed later this week, snap lockdowns targeted are still part of the national plan. Obviously at 80%, only in very difficult circumstances that they expected to be used. And I would hope that this is the last lockdown that we will see prior to reopening our borders.
And just to put a stopper in it, did you receive public health advice that this lockdown should have lasted 7 days?
No, look, and I heard that question to Dr. Veitch. The advice has been consistent from public health to me that the lockdown was for the 3-day period. Obviously, and I'd make this point, if things had changed and the risk had increased and more cases had become apparent, whether in quarantine or in the community, then we might have been having a different discussion today. I couldn't be more pleased with where we've landed. In fact, invariably in other jurisdictions they have gone into these snap lockdowns, and in most cases you've seen an extension of a day or two or even up to a week. In this case, we've got it early, we took the steps that we did, and we're in a position now where we can snap back and snap out of it.
Given that, Premier, are we extremely fortunate to be in this situation? I mean, we've got someone who's uncooperative, who's been potentially infectious in the community. We've had 2 people breach quarantine. Are we lucky to have avoided a Delta spread?
Well, look, I've always been of the view that the harder you work, the luckier you get. But in this case, obviously, we have been fortunate. This individual was in the community, he did test positive, and importantly we've seen no community transmission, and whilst there are still some close contacts that could potentially become positive over the remainder of their quarantine period, they are in quarantine and at no risk to the community. And so we have been fortunate, but importantly we've had a plan in place in terms of the snap lockdown now, which was released publicly some weeks ago. The community was ready for it, and everything worked as I would have hoped it could have.
Just briefly on another matter, there's been a death at Forestry Tasmania worksite, Sustainable Timbers Tasmania worksite. Is that disappointing to hear? Oh,
look, it fills me with great sadness. Look, anytime anybody loses their life unnecessarily, and so, look, in this case, I'd extend the government's sympathies to the family of the person that's deceased, and obviously a WorkSafe investigation will be undertaken.
Thanks all. Thank you. We're still live, if you want. Wait till I turn this off.